So Lucy says, we are a very small charity and have already asked our staff in a survey if they have accepted the vaccine. I don't think anyone has said no, but I want to record their second vaccination dates in our HR system. Is this allowed? Do I ask for it, or can I say it's mandatory to confirm the vaccination date?
I think unless you are one of the legally obliged organisations like care homes, making a mandatory policy, you need to have a justifiable reason for it. Each circumstance is so individual. I would hate to sort of give sweeping statements. But in this situation, you need a justifiable reason as to why you're recording this information. Some employees want to do this as part of a COVID secure workplace, but you really need to think end to end. If you're asking for vaccination status, if you're asking for vaccination dates, what are you going to do if someone either refuses to give it to you or hasn't had the vaccine? What are the consequences of that? You absolutely have the right to ask people, and it depends on the way you approach it. If you have already asked about the first vaccination and you've explained the reasons why you want to know, and that you're going to securely store this information, and employees were quite willing to give you that information, then you are absolutely okay to go and do that again. I just think you need to think about what the longer term consequences are. If someone says, I'm not telling you, or I'm not having the vaccine, what does that mean then?
Is deciding whether an employee has to isolate or not after the 16th of August, is that a legitimate reason to collect vaccination status?
It could be. Again, we are awaiting more detail on what that will mean going forward, and whether it will be an employer's duty to make sure that that is correct. So if someone is pinged to isolate, what we will wait for clarification on is whether that is an employer's obligation to make sure that is right, or whether it is down to an individual or an employee to be telling the truth on that, if that makes sense. I'm hoping that we will get some more clarification on exactly what that will look like in the next few weeks.
We are commercial cleaners. We work on multiple sites, albeit not care homes. If a client asks us to only send vaccinated staff on site, what do we do?
I think you need to understand the reason why that client is asking for vaccinated staff only. That would be the first thing you've got to do, and then find out, is that a legitimate reason? And you may need to seek some advice over what is and is not a legitimate reason. Because as I said, there may be companies who decide to mandate it, but they've got to come up with the reasons. But if they're also asking like subcontractors to do that, then that's a separate issue. So I'd be asking them why. I'd be asking them to see details of their policy. Then if there is a legitimate reason, then they will be seeing if you can manage that within your workforce. Have you got vaccine information? It may be that there is a legitimate reason, and then that means that therefore you have to collect the vaccination information as well. I think the difficulty at the moment is that we're still waiting for quite a bit of information on this. We are still waiting even for the detail on what it's going to be like for care homes. We just know that it's going to be happening and employers should be thinking about it. There isn't really any clear guidance on whether it is or it isn't okay for you to mandate it without government guidance. And it will all depend on very individual circumstances. I would certainly start with questioning why, and then that will allow you to translate into what that means for your business.
A question from Helen. If we want to protect our employees against infection and we have someone who refuses to have the vaccine, do we have the right to mandate that that person works from home instead?
Possibly, yes. It will all go back again, and it's probably the same kind of common theme in all these, is what is the reason for it. Obviously, there is a general push from the government that the vaccine is the best way to protect the country. But the government aren't mandating the vaccine. They are not making it mandatory at the moment, apart from care homes. Businesses who go into care homes to perform duties that are face-to-face, and there is talk of it being in the NHS. And that's where it makes it a little bit difficult. But if you believe that having gone through all the process that it is a legitimate reason to ask them to keep working from home and it's an alternative to them coming into the office. What you have to make sure is that you're not making them suffer a detriment because of that. So again, you need to go right back to why are you refusing the vaccine, explain the company's stance on encouragement to take the vaccine, why you're doing it, and then again, take it from there and seek specialist advice on that individual case.
Would we be allowed or able to inquire about vaccination status when recruiting and interviewing?
Yes, you can. You can ask for this information from employees and potential employees, but you need to be very clear about what you're using that information for and why. And I think that's going to be the key to all of this. Is if you're, you know, at a recruitment stage, if you're asking at a recruitment stage, there has to be a kind of a follow up to that. If you just ask the question and that's it, then that could lead to people not wanting to join or not even wanting to come to the interview because they're not sure why you're asking. Again, what are the consequences of them not doing? So if you have a candidate who says, I'm not going to tell you, or no, I've not had it, what does that mean? Are you just going to not interview them? Have they got no chance of getting the job? What is the consequence? And if you are trying to gain that you only want vaccinated people in the organisation, have you got that legitimate reason to do it? Because you just don't want to open yourself up to any potential employment issues further down the line. So if someone's saying they're not vaccinated because of a medical exemption, that's why if you are asking that question, it needs to be in a very detailed way.
We're an office-based organisation, so vaccines do not need to be mandatory, but we do have a member of staff who's refusing to have the vaccine, and other members of the team have caught wind of this and obviously aren't very happy about it because they're going to be in close contact with the person. So she'd just like to know essentially what they should be doing. So far, they've made their offices COVID secure. They've told their staff this in communications. They've encouraged staff to have vaccines through the newsletter, and they've even got lateral flow tests in reception. Is there anything else you think Antonia and her team could potentially be doing in this scenario?
I think what they've done so far is absolutely everything they should be doing. They've made every effort to encourage, support, guide their employees and make their workplace COVID secure. I think the next step would be if this is causing a problem with a particular person or a particular group of individuals who are not happy with the fact that this individual has not been vaccinated, then it would be treating that as kind of an informal employee dispute in terms of, you know, the relationships of work colleagues, and talking to those individuals and trying to kind of mediate and agree a way forward, because the last thing you want is to feel like the individual who hasn't had the vaccine, it's like a witch hunt against that person. So you're still managing a very delicate situation. I think everything they've done so far, it would just be if this continues, then there is the option to kind of try at a more local level to come to a reasonable conclusion.
In addition to instead of mandating vaccines, and I'm not sure what sort of business Diana works at, but she's asked as a workplace if they're allowed to mandate face masks and the use of the NHS Test and Trace app.
I think it would be perfectly reasonable to still say that masks are in place. Again, this is where it's really difficult that government have said, you know, use your common sense, but when you're trying to coordinate that against potentially hundreds of people with very different opinions, I think you need to be clear on what you are doing, why you're doing it, and this is helping mitigate risk. I certainly think things like masks, I think it would be okay to mandate them to wear masks at the moment as part of a COVID secure policy. Again, though, I would seek advice, because it all comes back to you can mandate it, but what you're going to do about the consequences of them refusing, and have you a justified reason to take action against it. And that's why it would, you know, even if you're putting a policy together about whether that's test and trace or masks, seek advice on that so that you can get that end-to-end policy process mapped out and you're very clear from the beginning, then you can be very clear with your employees.